Cranial for headaches and neck pain. Did you know that osteopaths can perform cranial osteopathy and that cranial can be performed all over the body, not just the head, although it's particularly good for headaches and neck pain. But I do agree, it's got a terrible name. In this video, I'm going to explain what cranial osteopathy is and the difference between cranial and structural osteopathy and also how it can help. Hi, I'm Luke Savage, Senior Osteopath at Worthing Osteopathic and Wellbeing Clinic. Imagine waking up with a headache or migraine every day. Well, this is true for a handful of my patients. One of my patients, Veronica, pops to mind. She gets headaches about 20 times a month. That's a lot of headaches. She'd been and had lots of different treatments for this, but nothing seemed to be working. She'd been to the doctors and tried the medications. She'd been to physios, acupuncturists, chiros, and even other osteopaths. When she came to me, she was thoroughly fed up and depressed. Suffering from neck pain and headaches? Then comment cranial below and myself or one of my team will get back to you. So what's the difference between cranial and structural osteopathy? A structural osteopath and a cranial osteopath work off the same principle, but cranial osteopathy is much more gentle and subtle approach to treating. So what's the difference between cranial and structural osteopathy? A structural osteopath and a cranial osteopath work off the same principle, but a cranial osteopath would have a much more subtle approach to treating. They use touch to feel the changes in the body, for example, injuries to the head or body. When it comes to the head, or anywhere in the body really, the cranial osteopaths are trained to move with the rhythm of the tissues, releasing tension and other obstructions. Cranial osteopathy is so gentle that you may not even notice or feel anything at the time of treatment, unlike structural osteopathy. My patient Veronica hadn't had any cranial treatment when she came to see me. After taking a case history and finding out what other treatments she'd tried, I knew I needed to try a different approach and decided to see how she responded to cranial treatment. As soon as I started with this treatment technique, I could feel it was going to make a massive difference for her. Suffering with neck pain and headaches? Then comment cranial below and myself or one of my team will get back to you. Here in our clinic, we see 40 to 50 patients a week with headaches and neck pain alone. Remember, pain is inevitable, suffering is optional. Thank you for watching.